Today is World Health Day, celebrated every year on April 7th. This year, it kicks off a year-long campaign focused on maternal and newborn health. The theme, Healthy Beginnings, Hopeful Futures, is aimed at urging governments and the global health community to intensify efforts to end preventable maternal and newborn deaths and to prioritize women's long-term health and well-being. The goal, ensuring every woman and baby not only survives, but thrives. Joining us via Zoom to explain why this observance is so crucial is Dr. Eldana Bosson, the Pan American Health Organization and World Health Organization country representative for the Bahamas and the Turks and Caicos Islands. Dr. Bosson, thank you so much for joining us today.
Good afternoon. Thank you so much for having me.
So let's start with why this observance is so important.
So this observance is important. Ever since 1950, countries have asked WHO to have a World Health Day, where there is an opportunity to kickstart a campaign to last for a year. It starts on the 7th of April every year, but to focus some attention on some global health issue that is important globally. As you said, the theme this year is Healthy Beginnings and Hopeful Futures, and we're looking at maternal deaths, maternal health, particularly women when they're pregnant and up to about 6 weeks after, and also the health of the newborn. Why is it important? Because it's a problem. It really is. Globally already, we know that there's about one preventable death every 7 seconds, 7 seconds. If we come closer to home, Latin America and the Caribbean, this last few years on average, we've had 7,200 deaths, mothers, per year. That is almost one maternal death every single hour, just in Latin America and the Caribbean. And if now we look at the newborns, if we look at the data, we see that amongst children who die age 5 or less, more than half, 57% of them, die in that crucial period, just 28 days after birth. So by any stretch and any measure, maternal health and the health of newborns is an issue globally and closer to home in Latin America and the Caribbean.
So how can we prevent this, seeing that this is a year-long campaign here within the Caribbean and Latin America, as you mentioned, of which the Bahamas is included?
Right. So it's something that we all have to tackle. It's government, yes, but it's also communities and societies. First of all, things like education for women, for them to be able to make the right choices about their bodies, about their health care, access and provision of health care. And that includes not just at the time of pregnancy, but before antenatal care. Women need to know and understand why they must seek antenatal care for their health, for the health of their children. And so there's many things that can be put in place to ensure that women have the care that they need, they have the access that they need, they have the education to understand what they need to do, and they have the support of the community around them as well. All of these are very important.
Is there any specific thing that countries like the Bahamas should be focusing on, particularly, or just those, just our better outcomes, or just the elements that you mentioned recently?
Well, there actually are some things that the Bahamas is already doing. For example, for us to actually know what's going on and for us to know if any of those things that we're doing is making a difference, or if we need to change tactics if they're not, they have to monitor and look at what the rates are all the time. And they have to do that accurately. And they're in the process of implementing a new system to do that. I'm sure in coming months you'll hear more about it. It's called SIP+, where we're able to monitor the health of the mothers and the children. And that's important for the country to know if we're on the right track, if things are getting better, things are getting worse, if we should continue what we do, if we need to change what we do.
And are you able to say, lastly, what events WHO has planned to keep this critical issue front and center?
Oh my goodness, there's so many in different parts of the world. I've been in contact with colleagues, and to kickstart today at least, press conferences, articles in the papers, posts, Ministry of Health have been doing conferences as well. Unfortunately, our Minister of Health is out of the country today, but they do have a lot going on. They are strengthening maternal and child health. They're moving towards the elimination of mother-to-child transmission of HIV and syphilis. So there's lots of things going on and things that can't happen in a day, which is why this is the kickstart. And things have to continue during the year to see it through and to bring fruit to what they're doing.
Well, thank you so much for your time, Dr. Basson, and for sharing these important insights with us. Wishing you all the best as we continue our discussions on this vital issue.
You're most welcome. It was indeed my pleasure, as always.
Well, coming up next, dieting and how critical it is for pregnant mothers. Stay with us.